We developed an evaluation of younger patients here in the MDS unit in Florence, University of Florence. The reason why we approached the younger patients with MDS is due to the fact that it is well known and more important to evaluate germline predisposition, especially in patients who are atypical MDS. That is, patients who do not have the median age that we are used to see in patients with MDS, like 70 and more. So we analyzed 21 consecutive patients with MDS and an age younger than 60. And what we did, it's quite an important evaluation, because we performed whole exome sequencing, both on bone marrow DNA and peripheral blood DNA, so circulating DNA as well. And we performed target next generation sequencing for the finding also of somatic variant. And whole exome sequencing was compared to bone marrow DNA and peripheral blood DNA was compared to that of saliva in the search of germline mutations. And on top of these findings, we also, as a confirmation after whole exome sequencing, performed a panel of 86 genes in NGS to check for hereditary anemias. Because what we found in 5 out of 21 patients was a mutation of PISO1. PISO1 is a gene that is critical for the differentiation of red blood cells, and it has been it is linked to a congenital hemolytic anemia, and it has been linked to other hematological disease. So the idea we developed is that these patients that presented MDS in an unusual young age could be indeed showing anemia. That was the principal cytopenia of these 5 patients, because of the concomitant mutation in PISO1 that is determining by itself a predisposition to anemia. It's not always manifest as a disease in the patients who carry this mutation, but in our case, it may be a concomitant cause of the early onset of anemia. The patients we evaluated also presented somatic mutation, the recurrent typical MDS somatic mutation, to confirm our diagnosis. All but one. And in fact, one of the 5 patients, although was diagnosed with MDS and referred to us for a second opinion, was in fact not showing a somatic mutation, which is quite difficult because more than 90% of MDS patients do have somatic mutation. And when we studied the case with more attention and more sophisticated method, we could demonstrate that this specific patient actually carried 4 germline variant for different hemolytic anemias. So in this case, we could not confirm MDS, but a concomitant presence of many germline variation for hemolytic anemias. Thus, the bone marrow morphological appearance simulate the MDS morphology. Now, this is a warning, because we should add this evaluation to patients who have MDS, because sometimes we may under-evaluate and underestimate this aspect, and therefore conclude for an MDS diagnosis that is not precise.